طيب يعطيكم العافية. إن شاء الله اليوم راح نبلش بآخر محاضرة للفصل، وهي الجزء المتبقي من الديابيتيك انتي ديابيتيك ميديكيشنز أو الهايبوغلايسيميك ايجنتس. حكينا المحاضرة الماضية عن الديابيتس، تعريف الديابيتس، المانجمنت للديابيتس، وحكينا عن السلفونيليورياز زي الجليمبرايد الجليبيرايد، حكينا عن ميجليتينايدز as well، كلهم حكينا عنهم are in general considered as insulin releasing agents. بلشنا في بعض الشعاب المحاضرة الماضية وذكرنا عن البايجوانايتس اللي هم مثال عليهم الميتفورمينز، بس للتذكير في بعض الشعاب ما تمكنا من انه نخلص هذا الجزء، فبرجع بعيد من هذا الجزء ان شاء الله وبكمل من هذا الجزء لحتى ننهي محاضرة الهايبوغلايسيميك ايجنتس. حكينا عن البايجوانايتس وذكرنا البايجوانايتس انهم originally inspired from natural compound that was called as isoamylene guanidine, and that compound structure is over here. It's a natural product, as we can see, and this natural product is isolated from a plant called Gallica officinalis that was used long time ago to reduce urination in some people that they didn't know at that time. زمان ما كانوا يعرفوا إنه urination or polyurination in general is considered as a sign of diabetes mellitus, so they thought that treatment of polyurination can be by this plant. Eventually صار في isolation للactive compound that was treating the polyurination, which is isoamylene guanidine. And so that isoamylene guanidine was discovered to be the active compound that was basically producing anti-diuretic effect أو reducing urination، اللي هو in general كان مش anti-diuretic، كان treatment of diabetes. This compound was not very stable, was not used as a drug because of its instability basically, and so eventually scientists were able to find out there is another similar structure, similar pharmacophore that we call as biguanides. البايجوانيدز هم عبارة عن 2 guanidine moiety. This is a 1 guanidine and this is the second guanidine moiety. من اسمهم biguanides, they have 2 guanidines and they are used for treatment of diabetes by reducing hepatic glucose production. And in general, that reduction in hepatic glucose production results also in enhancing insulin sensitivity. And so an example, a very important medication for treatment of diabetes, and it's the first line therapy for treatment of diabetes, is metformin, which is an example on these biguanides. It's very similar to biguanides core structure. زي biguanides core structure. الاختلاف فقط وجود 2 methyls عندنا هون. So it's dimethyls على nitrogen terminal nitrogen to generate what we call metformin. And that metformin compound is, we know that it is the first line therapy or first line treatment for type 2 diabetes. وذكرنا metformin is quickly absorbed from the small intestine. It has decent bioavailability, and this is not bound to proteins because it's very polar structure, and it is excreted unchanged. And the reason why it's excreted unchanged because or بيصيرش عليه أي modification أو metabolism because it's very polar structure بسبب وجود عدة nitrogens فيه بيخلي structure extremely polar, and that in general would make the structure polar enough to be excreted as it is. حكينا it accumulates in the wall of small intestine or the cells of the small intestine, and that create a depot basically, which makes the half-life of this compound longer. So it basically creates a depot in the small intestine cells and gets released slowly over time to increase the concentration of this compound in the plasma. So in another word, would cause longer half-life for this molecule. But at the same time, we said also that could cause side effects, and that side effects is caused by the higher concentration of the drug inside the small intestine. And these side effects include drug-induced gastrointestinal distress. Sometimes they cause diarrhea as well. And this is something can be minimized sometime if patient take the medication with food, although this might affect the bioavailability of the medication as well. ذكرنا كمان إنه الميكانيزم how they work specifically الميتفورمين as we said they reduce hepatic glucose production. وحكينا ببعض الشعب يمكن ما ذكرنا إنه الميكانيزم these compounds work on blocking the mitochondrial respiratory chain complex 1, which is important for production of ATP. So that blocking that would reduce the oxidative phosphorylation and decrease the ATP synthesis. Reduction in ATP synthesis results in an increase in the concentration of AMP لأنه ال AMP ما بتحول ل ATP من خلال respiratory chain complex which is blocked by metformin. Increase in AMP بصير عندنا هنا AMP activation of some protein kinases. That protein kinases activation result in inhibition of gluconeogenesis. In another word, inhibition of making glucose and reducing from the liver and reducing glucose in the blood eventually. Metformin, as we said, is not metabolized and it's actively excreted unchanged in the urine because it's very polar structure. It doesn't cause hypoglycemia and it doesn't induce weight gain. So it has many beneficial effects للpatient. Not only reducing blood sugar, but it doesn't cause hypoglycemia زي السلفونيليوريا. It doesn't induce weight gain. And it's also considered to have anti-hypertriglyceride effect as well, and some vasoprotective effect. So these all things together make this drug very beneficial, very ideal, and so this is why it is basically used as first-line treatment. There are some medications that affect the absorption and the excretion of that compound. For example, cimetidine can significantly alter metformin pharmacokinetics. And this is because metformin is very polar. They need to use some ion channels to be transported into the intestinal cells and to be excreted as well in the kidney. اوكي سو يعني فقط بهمني تعرف الميتفورمين والستركشر تبع الميتفورمين بهدول البايجونايدز وهو اهم دراج حاليا مستخدم بالتريتمنت اوف تايب 2 diabetes. بنكمل بالمحاضره. اذا هيك بنكون خلصنا البايجونايدز وراح نحكي عن النكست جروب اللي هي راح تكون النكست جروب اللي هي thiazolidine diones, and these are what we call insulin tissue sensitizers. And so these compounds, thiazolidine diones, they work on peripheral tissues, specifically the muscle with adipose tissue, and they enhance these compounds sensitivity to insulin, so they allow a better glucose uptake by these tissues. These compounds work as on basically nuclear receptors, nuclear hormone receptors, specifically that we call as peroxisome proliferator activated receptor gamma. حكينا عن ال PPPR سابقا بس as a different kind of a PPPR receptors, nuclear receptors سميناهم PPPR alpha. وحكينا ال PPPR alpha activation is good because it is the mechanism for fibrates to reduces triglycerides, so it's used as anti-hyperlipidemic agent fibrates by activating this PPR alpha. اليوم نحكي عن PPR gamma, and the PPR gamma is a different type of receptors that if they get activated, for example they get activated by اللي هم الكومباوند اللي رح نحكي عنهم هلا thiazolidine diones, their activation results basically in increase of insulin sensitive glucose uptake transporters in the adipose tissue as well as the muscle tissue. And so when you activate PPR gamma, these tissue can produce more of these transporters بنسميهم GLUT4 أو أحيانا نفسهم هم الانسولين sensitive glucose uptake transporters. And so the tissue sensitivity overall for insulin increases, and they can take more of the glucose from the plasma or the blood, so they reduce the blood glucose concentration. So in general, these compounds work through what we call activating the PPR gamma, and the activation of the PPR gamma would result in changes in gene expression that causes increase in insulin sensitive glucose uptake. وراح ارسم اكتب هون الاسم الترانسبورترز GLUT4, and this increase in insulin sensitive glucose uptake transporters results in improved insulin sensitivity in muscle and fat tissues and as well in liver without increasing insulin secretion. So we're not affecting insulin secretion, تمام? But we don't change anything about insulin secretion. So they usually don't cause hypoglycemia when used alone. And because this is a genomic effect, they increase expression of certain transporters اللي حكينا عنهم GLUT4. This is usually a slow effect that takes days to weeks to see the effect, hypoglycemic effect of these compounds, تمام? And so you want to take this into consideration when you give the patient thiazolidine diones, لأنهم in general they take a bit of a time to increase the expression of certain transporters through activating these nuclear hormone receptors اللي هم سميناهم PPAR gamma. So these results in activation of or expression as well as transcription of these GLUT4, which are insulin sensitive glucose uptake transporters. تمام؟ طيب هلا شو الكور ستراكشر لهدول كل هدول الكومباوندز؟ And the core structure of these compounds is this core structure that we call benzyl thiazolidine diones. هذا الستراكشر اللي هو بنسميه thiazolidine. Let me use a different color just to make it easier for you to see. Okay, and let's use that color. So this is called thiazolidine structure. تمام؟ هذا اسمه thiazolidine structure. And the word dione as well comes from these two carbonyls اللي موجودين عندنا هون dione. ولو بدنا نرقم بنبلش الترقيم عندنا as we can see from the sulfur. So it's 1, 2, 3 nitrogen and 4 carbonyl. So that's why we call it 2,4 dione to represent the two ketone-like structures or اللي هم two carbonyl moieties. So you have thiazolidine dione, and then you have the 5-benzyl structure, which is this benzyl moiety in that part. Okay, so now we know what is the core structure, which is again 5-benzyl thiazolidine dione, and these compounds work by activating PPR gamma nuclear hormone receptors, which basically increase the transcription for GLUT4, which are insulin sensitive glucose transporters. طيب خلينا نشوف some examples على هذول medications which are thiazolidine dione. And the examples that we have, again, I don't want you to know the structures except this core structure. هذا المهم الجزء الأهم اللي هو من اسمه benzyl thiazolidine dione. طيب البنزل thiazolidine diones عندنا various lipophilic parts attached to this structure that's added to the structure. Now all of these compounds are the same more or less. They are activating PPR gamma. بدنا نعرف انه فقط انه الكومباوند اللي هو troglitazone is not existing in the market. It was withdrawn from the market because of severe hepatotoxicity. And so because of that severe hepatotoxicity, that compound was withdrawn from the market. We still have rosiglitazone as well as bioglitazone in the market. Rosiglitazone had at some point had some black box warning, but now it's removed. So we still have those two compounds that can be used for reduction of glucose, and they are just basically what they do. They enhance the tissue sensitivity to insulin. So bioglitazone and rosiglitazone are two compounds that are still in the market, and they act by activating PPR gamma. هلا حكيت أنا قبل شوي عن ال PPR alpha. إذا بتتذكروا حكينا ال PPR alpha is the target for fibrates for reduction of triglycerides, صح؟ So these compounds, there is research هلا موجود إنه can we create a dual PPR alpha and gamma at the same time agonist. ليش؟ لأنه these dual agonists could be very beneficial in basically as anti-diabetic medication and reducing as well as anti-hyperlipidemic medication. لأنه mostly diabetic patients have high triglycerides as well. So if we can activate both in one medication, that would be very beneficial for those patients that have hyperlipidemia and diabetes as well. So this is a new research that's currently being studied. Okay, so this is the second group اللي هم thiazolidine diones اللي حكينا عنهم. وأتوقع الأمور واضحة. Very simple structure. Benzyl thiazolidine dione They act by activating PPR gamma. They increase the tissue sensitivity to insulin, so they take more glucose and reduce the glucose level in the plasma as well, in the blood. طيب نحكي عن النكست جروب. طيب النكست جروب of the hypoglycemic agents that we'll talk about today اللي هم compounds that work on reducing carbohydrate absorption. And this is the fourth group that we talk about in this class of hypoglycemic agents. هلا واحدة من المشاكل طبعا الشوجر انه يعني الدايابيتس انه الشوجر يتم امتصاصه بسرعة من GIT after meal or post meal. So there is a spike in blood glucose after meal. And there was an idea that can we reduce basically absorption of these sugars from the GIT. And so the main enzyme that involves in absorption of these sugars from the GIT is an enzyme called alpha glucosidase enzymes. And these are a group of enzymes. It's not a one enzyme. It's a number of enzymes together that include maltase, saccharase, isomaltase, and glucoamylase. They are located in the brush border of the small intestine. They are located in the outside area of the small intestine cells. And so these are all a group of enzymes that we call all together as alpha glucosidase. So these are enzymes that destroy or break the disaccharides to monosaccharides to make them easier to be absorbed. Okay, so what they do is that they cleave the disaccharide, and they are cleaved by alpha glucosidase enzymes to convert them to monosaccharides that can be absorbed easily by the sugar transporters, and that can increase the blood glucose quickly after eating a meal. طيب هلا the idea is that these compounds or this alpha glucosidase, if it's inhibited, we can stop the absorption of these sugars from the GIT. And so this is where it comes that there are inhibitors, or we discovered inhibitors that can block the active site of these alpha glucosidase and prevent the disaccharide cleavage, so these disaccharides cannot be absorbed anymore, so we reduce the blood sugar level or the glucose level in the blood in general. Okay, so these drugs are competitive inhibitor of the alpha glucosidase. They delay carbohydrate absorption, and so the carbohydrate becomes just not cleaved, and they stay undigested. They pass to the small intestine, and they will reduce the chance of increasing the glucose level in the plasma. And also a very interesting thing about these compounds that they usually, after they block this alpha glucosidase, themselves don't get absorbed. They will be excreted unchanged in the feces as well. One of the issues of these compounds, because they allow a lot of sugar to reach large intestines, the colon, without being absorbed, that causes usually GI upset, it causes flatulence, it causes sometimes diarrhea in some patients. So there are some side effects associated with these molecules. And there are examples of these compounds that are used currently in the market, say acarbose. Acarbose is a polysaccharide that's used for basically, it's an oligosaccharide that's isolated from actinomyces. Actinomyces اللي هي بكتيريا. الايزوليشن له من بكتيريا بتلاحظ انه هو multiple sugar units. هو فعليا what it does is inhibits this alpha glucosidase competitively, so it binds to it, doesn't allow the disaccharides to come and bind. And it is the drug of choice in this category, acarbose. And there is no risk, of course, of hypoglycemia or weight gain in these medications زي السلفونيليوريا. ليش؟ لأنهم ما بيأثروا على الأنسولين وما بيأثروا على الجلوكوز absorption in terms of, doesn't increase glucose absorption, so it doesn't cause weight gain. And so these compounds, as we know, they're very safe, very effective. They're able to reduce the HbA1c between 0.5 to 1%. So they're not a huge reduction in HbA1c, but it's significant. It can be used in combination with other medication. Okay, They can cause, of course, GI irritation and flatulence, bloating, as we said, because of the fermentation of the undigested sugars that reach the large bowel. And this is some of the issues of these alpha glucosidase inhibitors. Other medications as well that exist, the elbogilbose والميglitol. Elmiglitol والبوغليبوز, these two medications also another example. They contain an amine, as you can see in the structure, and this contains an amine. The amine here is important to say that makes those compounds are what we call them as pseudo carbohydrates. فهذول مش real carbohydrates, they are pseudo carbohydrates. تمام? They're not true carbohydrates, they're pseudo carbohydrates. And they mimic the natural substrate. What they do is that we mimic a natural substrate اللي هم other disaccharides اللي بنحكي عنهم. The ring in the nitrogen اللي هو النيتروجين اللي موجودة بالرينج سواء كانت بالميglitol أو كانت outside زي البوغليبوز أو النيتروجين اللي موجود هنا as well بالأكاربوز is very important, and it's positively charged at physiological pH. Yes, so it has positive charge. That positive charge mimics basically the charged oxonium ion اللي موجودة هون عنا. راح تكون charged لما نعمل cleavage لهاي الدايسكرايد بالانزيم. In the enzyme راح ارسم كيف just again to show. In the enzyme over here, what they do, they protonate oxygen to generate an oxonium ion to allow the breakage of this bond easier. So that positively charged oxonium ion is mimicked in these compounds اللي حكينا عنهم over here. And so it mimics the positively charged oxonium ion transition state in hydrolysis of these disaccharides, which leads to very strong or tight binding to the enzyme اللي حكينا عنه الالفا glucosidase. So that results in very tight binding. So this is a key. الامين هاي مهمة جدا وجودها بهاي structures. تمام. Okay, so this is just what we want to know about these carbohydrate absorption inhibitors, if we want to call them, and they just work by inhibiting these carbohydrate absorption, specifically disaccharides, and by inhibiting the cleavage of these disaccharides. طيب. Let's go to the next class of hypoglycemic agents اللي هم what we call them as SGLT2 inhibitors. Let's understand first what happens in the kidney. And in the kidney, all plasma glucose is filtered into the renal tubules. تمام. مش في عنا بيجي ال veins coming and they filter in some of the components, but the glucose is filtered completely into the renal tubules. And so in after the filtration process in the proximal convoluted tubules, the sugar should be fully reabsorbed into the plasma in normal people. So in theory, urine should contain 0 sugars in healthy individuals. صح؟ so the nephrons absorb all filtered glucose through 2 types of sodium glucose transporters, and SGLT1 and SGLT2. SGLT2 is the one that's responsible for reabsorption of 90% of the glucose with proximal convoluted tubule. وزي ما حكينا كل الجلوكوز الفلترد بالجلوميرولس بيصير له full reabsorption in the proximal convoluted tubules in the nephrons. So all of it will be reabsorbed back inside to the cells in the proximal convoluted tubules, and there will be another transporters, which is the GLUT4 transporters that GLUT2 transporters that transport the glucose back into the bloodstream. And so the urine should have 0 glucose eventually in healthy individuals. تمام. In diabetic patient, the plasma glucose often reaches levels above the threshold of these SGL2 transporters. And so the urine will contain in diabetic patient glucose, and that's what we call as I'll write the term over here, that we call as glycosuria, which is basically the وجود الجلوكوز in the urine. We call it as glycosuria. Let me, طبعا الكتابة مش سهلة هون فراح أكتبها مرة ثانية. So diabetic patient has glucose in their urine, what we call as glycosuria, and this is a classic sign of diabetes. okay, that we have glucose. هلا when we have excretion of glucose in these diabetic patient بصير في عنا automatically upregulation of these SGL2 inhibitors. شو يعني upregulation؟ يعني بصير الجسم يصنع اكثر SGL2 transporters، صح؟ كل ما يصير في جلوكوز اكثر موجود باليورين راح يصنع الجسم automatically more of these transporters عشان يحاول يرجع الجلوكوز back to the blood. So in diabetic patient you'll see that the issue is also that we have more SGL2 than normal healthy individuals. So it makes a lot of sense that if we can find blockers for these SGL2 or that blocks the glucose transportation in this SGL2 would be a very effective way to lower blood glucose sugar. And so this is an important transporter لأسبابين. ليش مهم يكون في عنا inhibitors أو blockers لهدول ال SGL2؟ أول إشي لأنه ال SGL2 بيعمل reabsorption about 90% of glucose. ورقم اثنين إنه بيكون upregulated in diabetic patient هذا transporters. So it's an important thing that we find an SGL2 inhibitors that inhibits the reabsorption of glucose from the urine. So we reduce the glucose level in the plasma by as much as 20% if we can do a good inhibition of these SGL2 transporters. تمام؟ طيب, let's talk about then the basically inhibitors story. So the first compound that was discovered as SGLT, اللي هم cotransporters inhibitors, is a compound that was isolated from nature. So they found that the apple tree barks, once they are eaten or taken as basically tea, there's a compound in this that's called fluorescein, and that fluorescein, you will see it's a sugar-like unit, has a glucose-like unit, as well as an A-glycone moiety, اللي هي non-sugar unit. طبعا non-sugar unit we call it as A-glycone. So that part اللي هو non-sugar unit is called as A-glycone moiety, and that's the sugar unit over here. تمام? So these compounds, what they do is basically they inhibit SGLT2 transporters because they compete with these glucose-like units. This is a glucose unit over here, and so they compete with the glucose. They cannot be transported, they just block the glucose basically binding site in the SGL2. And so blocking these SGL2 inhibitors would result in reduction of glucose absorption or reabsorption. So this is an important unit to have the sugar-like unit, which is the glucose. بتكون مرتبطة على A-glycone moiety, هي aromatic moiety, as we can see. Now it's the product, this compound, the natural compound, was never used in the market as a drug. Why was it never used in the market as a drug? Because you see there is what we call glycosidic linkage, صح؟ وهاي الglycosidic linkage اللي هون ال O-glycosidic linkage or O-glycoside is target for an enzyme that we just talked about a little bit ago, اللي هو glucosidase enzymes, صح؟ So these enzymes destroy هاي ال O-glycosidic linkage or O-glycoside linkage, and they destroy the structure, so they release الشوجر لحاله الجلوكوز, وبالتالي بصير له امتصاص. بعد هيك فبالتالي كان مش effective كثير لأنه عنده metabolic labile or unstable part اللي هو وجود ال O-glycoside, specifically هذا الجزء اللي بنحكي عنه, وجود هاي الأكسجين زي ما حكينا, اللي هي target لإنزيمز الجلوكوسيديز enzymes, سواء كانت بيتا أو ألفا. بهاي الحالة بتكون بيتا جلوكوسيديز that destroys هاي الجلوكوسide linkage, and they open up the ring to allow for glucose to be released or to be absorbed. But as a medicinal chemist, they looked at the structure and they said, well, can we try to get rid of this O-glycoside linkage اللي هي عاملة مشكلة instability, صح? Can we get rid of this oxygen? And can we connect these two things together without the oxygen? And this is what they did. And this is the class of compounds that we will talk about that doesn't have an O-glycoside. There are two the carbon and the phenyl ring, or the aromatic ring, the carbon of the sugar and the aromatic ring are attached directly to each other. And so this is what we call C-glycoside. C glycoside. ليش C glycoside? It's called C glycoside because, let me just write it correctly, it's C glycoside because there's two carbons are attached to each other without the oxygen. And so this is what we call the C glycoside solution to create what we call as these compounds, the class of compounds that we call them as glyphosines, or these compounds that we'll talk about in a little bit. So the key innovation here was replacing this unstable O linkage with a strong carbon-carbon bond that cannot be destroyed by glucosidase enzyme. And that created a class of compound that we call them as glyphosine class of compounds which are resistant to hydrolysis and orally bioavailable compounds. And so basically this is a very important class of compounds that prevent the reabsorption of glucose in the urine. Let's talk about example of these medications. So this is the class of molecules that we'll talk about, the glyphosines. We have various compounds that we call them as canagliflozin, dapagliflozin, empagliflozin, as well ertugliflozin. You'll see they have the same pharmacophore اللي حكينا عنه سابقا. عندنا موجود A glycon part, lipophilic A glycon moiety, وعندنا glucose head. And the glucose head is mimicking the natural glucose that gets reabsorbed طبعا. And so they bind effectively لل SGL2 transporters, they inhibit the reabsorption. مهم جدا نعرف انه كلهم فيهم سي جلايكوسايد لينكرز اللي حكينا عنهم، ما فيش فيهم الاكسجين. هي هاي اللينكج between the A glycon والجلوكوز هيد، هاي سي بوند، سي بوند او سي جلايكوسايد لينكر تسميها سي جلايكوسايد لينكر. They're stable, they have good half-life, they're lipophilic, and their A glycon tail or moiety is the one that dictates their potency. تمام؟ يعني this affects the potency a lot of A glycon part. Okay. So they work by inhibition of SGL2 co-transporters, and so in fact these co-transporters, once inhibited by these enzymes, we reduce the glucose level by as much as glucose plasma level by as much as 20%. طب كيف بيصير لهم metabolism? The way they get metabolized is through the enzymes اللي هم مسميهم UGT enzymes that catalyzes glucuronidation. And so these are crucial phase 2 metabolism إذا بتتذكروا من medicinal 1. The UGT glucuronidation enzymes, what they do is that they detoxify some compounds by addition of glucuronic acid unit. They add a glucuronic acid unit, and that glucuronic acid unit that's added to these molecules would deactivate them or destroy their activity. It's because they make them more polar, easily excreted. So that's glucuronic acid added to the moiety, usually added على هاي الهيدروكسي تبعت الهيدروكسيل اللي موجود التيرمينال هيدروكسيل اللي موجودة بالsugars بالglucose sugar units. And so addition of that by UGT enzyme will deactivate these compounds. On the addition of that, of course, on the hydroxyl group of the glucose moiety, produce inactive renally excreted metabolites. So that destroys their activity. Okay, so just to summarize, أنا ما بيهمني تعرف كل structures هون، فقط بيهمني تعرف إن عندك sugar unit, lipophilic A glycon tail, they bind SGL2 transporters, and they inhibit the reabsorption of these sugar units, glucose to plasma. They're stable compounds because of their CC linkage or C glycoside linkage, and their metabolism is done by UGT glucuronation as well by addition of the glucuronic acid unit to these enzymes. Okay, let's talk about the last topic of these hypoglycemic agents, which are related to the incretin effect. So this is the last target we'll talk about اللي هم harnessing the incretin effect. هلا لما نحكي شو يعني incretin effect, the incretin effect is something wasn't discovered until much later. That in general, when you give oral glucose for people, a dose of oral glucose, let's say مثلا 50 grams of oral glucose given to people, that oral glucose dose stimulates insulin secretion much more than if you give the same dose by intravenous injection to these people. So if you look at this diagram here that shows basically this incretin effect, that you'll see this is the insulin amount and this is time. when you give people oral glucose, you'll see there's a huge jump in insulin secretion. على العكس لو تعطي نفس الsugar amount by intravenous dose or injection, insulin secretion would be very low compared to that. So there is a huge difference in insulin. Wasn't understood very well until much later that we found gut hormones called incretins, or we call them as incretins, released in response to meal. And these gut hormones basically that are two hormones which are GLP, what we call glucagon-like peptide, one GLP-1, which promotes glucose-dependent insulin secretion, suppresses glucagon, slow gastric emptying to allow a good absorption of the components of the meal. The other enzyme that we're not, sorry, the other hormone, incretin hormone that we're not going to talk about so much, but it's also you should know is the glucose-dependent insulinotropic polypeptide, or what we call as GIP. So these are the two key hormones that we have, GLP-1 and GIP. And these two hormones are very important in basically promoting insulin secretion, reducing gastric motility, slow gastric motility to allow basically slow gastric emptying for the food that we have to allow better absorption. And they as well they suppress glucagon. And so you will see that this is a glucagon-like peptide. One is a 36 amino acid peptide, so it has 36 amino acids in the structure. It's important to know that they have 36 amino acid in their structure, and they are secreted by what we call L cells of the guts in response to meal. It does have a very strong effect over glucose level by promoting insulin secretion in a glucose dependent manner. تمام؟ طبعا هذا الافكت زي ما بنحكي اللي هو هذا الجي ال بي 1 is discovery from what we call the incretin effect. هلا الجي ال بي 1 so they have good effect على الانسولين glucose dependent insulin secretion و they slow gastric emptying. هلا الجي ال بي 1 مشكلتهم they're very powerful compounds, they're very powerful peptides, they release a lot of insulin. كل هذا الريليز اوف انسولين بسبب الجي ال بي 1 والجي اي بي ومينلي الجي ال بي 1. لكن مشكلتهم they have very short half life because they're peptides. They have only half life of 1 to 2 minutes maximum, and that's because of an enzyme that we call it DPP4. طبعا as we can see that the name of that DPP4, which basically cuts the 36 amino acids GLP hormone to make it inactive. And so what these DPP4, they remove dipeptide from the N terminus, and they result in inactivating these GLP-1 or this GLP-1 hormone. So this was the main issue انه ليش مثلا ما نعطي GLP-1 للناس whether it's orally, IV, whatever it is, and basically use it as a good compound or a good hormone to enhance insulin secretion for the diabetic patient, and also to reduce gastric motility, which results in a feeling of fullness إنه الشخص راح يحس بالشبع بسبب السلو of this gastric emptying, slowness of gastric emptying. So اجوا الناس يعني لما اكتشفوا scientists لما اكتشفوا ان GLP-1 has this effect, their main thought was, can we use GLP itself? Of course we can't use it. We cannot use it because it has a very short half-life, 1 to 2 minutes, because of this metabolizing enzyme اللي هو DPP4. And so this created a lot of discussion between medicinal chemists. Can we modify these structures to make them either more resistant to this DPP4 enzymes? This is the fair strategy. Can we re-engineer them to make them a better GLP-1 like compounds with a strong resistance to DPP4s, يعني in another way to increase their half-life? Or can we create inhibitors for these DPP4 compounds, or sorry, DPP4 enzymes, compounds that inhibit DPP4 enzymes اللي هما dipeptidyl peptidase enzymes. DPPB stands for dipeptidyl peptidase enzyme. because it removes two basically amino acids. We called it dipeptidyl. وحكينا عن dipeptidyl سابقا enzyme يفترض انكم تعرفوا شو هو. طيب, so the second strategy was, can we find inhibitors for the DPP4 enzyme to يعني increase the half-life of GLP-1? And so these are the main two strategies. As we said, طبعا GLP is very important because it does have a lot of good effects. First of all, it reduces appetite and food intake. It reduces gastric emptying. It increases glucose uptake because it increases insulin synthesis and secretion, and it reduces glucagon production. It's well known to have cardioprotective effect, which is something that's very beneficial as well for diabetic patient. لذلك ال GLP-1 يعني فعليا هو one of the best discoveries in diabetes after metformin. Of course it does reduce the glucose level, glucose sugars, بس كمان بتقلل الفود يعني الابيتايت فور فود. وبالتالي الواحد من استخداماتهم ال GLP-1 agonist راح نحكي عنهم هلا a little bit later, that they were used for a long time. They were used as well for reducing the weight in general, other than reducing sugar levels. So that was very good effect. It's not only reducing sugar level, it reduces weight because it reduces appetite for these people. It does have also a cardioprotective effect. وللعلم هلا في كثير studies showing that these GLP-1 agonists can be used for treatment of addiction, which is very strange, something people didn't discover or expect or anticipate until much recently they found. So these GLP-1 agonists or GLP-like compounds that have GLP-1-like activities would be very, very, very beneficial and very effective. So there was a big amount of research was done to try to discover stable GLP-like GLP-1 analogs. And so the first thing that people worked on very hard to try to engineer a better GLP-1 like compound that has a better, longer half-life than just GLP-1. And so the first thing that they tried was to learn from nature, and this is what we always start our research from. As you remember, زي ما شفنا قبل شوي الميتفورمين was discovered from nature. وشفنا قبل شوي كمان الapple tree parks produced a natural product that was basically developed further into the real compounds. Now the next story, you will see it's also something that was inspired from nature. There was a 39 amino acid peptide from Gila monster saliva, من لعاب الجيلا مونستر. الجيلا مونستر الصورة لها موجودة هون. هي زي يعني بدنا نحكيها زي السحلية عندنا بسموها، بس larger body in general، موجود في المناطق الصحراوية. اجوا اخذوا من اللعاب تبعها عينة ولقوا فيها peptide that has 39 amino acid. And these 39 amino acids was found to have similar effect to GLP-1. What is better than that this 39 amino acid peptide, once it's injected by subcutaneous, it was found to be resistant to DPP4 degradation, better than GLP-1. GLP-1 half-life about 1 to 2 minutes. This peptide اللي بنحكي عنه exenatide, this is the name of that peptide, has half-life 3 hours. So exenatide has shown to reduce HbA1c levels in sulfonylurea treated patient with type 2 diabetes and is associated with weight loss. طبعا الweight loss زي ما حكينا is probably due to decrease in appetite. So this is the first discovery of GLP-1 like compound that is resistant to DPP4, and it is believed that the resistance of DPP4 because of this glycine, specifically at position 8. There was alanine in that GLP. بالGLP هون بهذا البوزيشن راح ارسم هون. كان موجود عندنا هون بالGLP-1 بيبتايد، بدل هاي الجلايسين موجود عندنا alanine. والالانين هاي اللي هي امينو اسيد نمبر 8 هي GLP-1. لو طلعنا على الامينو اسيد مش هو في 36 امينو اسيد. امينو اسيد نمبر 8 هو عبارة عن alanine. تمام. So الالانين هاي between 7 و 8، يعني هي 8 هي الالانين اللي هي رقم 8. الرابطة اللي between 7 و 8 تحطم بسهولة by DBP4. تمام. فلقوا انه لما تغير هاي الالانين اللي موجودة هون ب other amino acid, in this case it's glycine. تمام. When you replace that alanine at position number 8 to glycine, in this case, that makes this resistant to DBB4. So that switching of alanine to glycine enhanced the half-life of this compound. And so that compound had a half-life of 3 hours because of this main amino acid. Although there are other changes لأنه هو 39 amino acid أصلا هذا الستركشر تبع الاكسناتايد اللي هو الامينو اسيد اللي هو البيبتايد اللي جاي من الجليا مونستر سلايبا. تمام. التشابه بينه وبين الجي ال بي 1 حوالي 50% تقريبا فقط، يعني 50% من الامينو اسيد مشابهه للجي ال بي 1. بس اهم امينو اسيد تغير وسبب الدي بي بي 4 ريزيستنت اللي هو الجلايسين اللي موجود على رقم 8. هاي الجلايسين كانت اوريجينالي الانين بالجي ال بي 1 وهو السبب كان للكويك بيسكلي ميتابوليزم باي دي بي بي 4. طيب هلا زي ما حكينا له انتي دايابيتيك افكت هذا الاكسيتايد، له كمان weight loss effect in general, and it was also believed to have a delayed the onset of diabetes, so it had some prophylactic effect for these people that are likely to develop diabetes type 2, especially اللي بيكون عندهم oral glucose tolerance test abnormal. So this compound didn't make it to market because 3 hours wasn't long enough يعني for this compound اللي هو البيبتايد this peptide to be used الاكسيناتايد clinically، لأنه بدك تعمل injection للشخص كل 3 ل 4 ساعات بهذا البيبتايد which wasn't feasible, wasn't realistic. Researchers kept doing more research to try to find compounds that have better half-life, and this is the next strategy. هاي الاستراتيجي الأولى اللي حكينا learn from nature. Strategy A. Now strategy B is basically to do an acylation to increase albumin binding. So in other words, acylation for these peptides is believed to increase the lipophilicity of the structure. And so, read from. And that the increase in lipophilicity would increase binding to albumin, of course. صح? So that was the theory that if we can increase the lipophilicity of these structures by attaching a fatty acid اللي بنسميها acylation, attaching a fatty acid or acylate that amino acid, this can result in a compound, peptides become more nonpolar, and we use this tail, fatty acid tail, to bind to plasma albumin, and so that slows the renal clearance, slows the exposure of the compound to DBB4 enzymes، وبالتالي راح يزيد الهاف لايف. أول compound انوجد فعليا كان هو compound very similar to GLP-1, and it has about 90-ish% similarity in terms of amino acid sequence لل GLP-1. So sequence one very similar to GLP-1, and الاختلاف موجود عندك باللون الأزرق هو هدول الأمينو أسيد. مش مهمة، لكن الأهم بالذات تعرف إنه تم إضافة فعليا C16 fatty acid أو 16 carbon fatty acid. تمام. إضافة C16 carbon fatty acid with this glutamine linker, you will see that obtains a strong albumin binding. So الالبومين بيجي هون بيرتبط على هذا. This is an albumin طبعا, and it does make hydrophobic interaction مع هذا الجزء الهيدروفوبيك tail, C16 fatty acid, and that made the structure with very decent half-life. The half-life of this compound is around 13 hours. So the half-life of this peptide اللي هو liraglutide is half-life T-half is 13 hours. تمام. And that's just because of a simple change. أهم change عملوها اللي هو وجود C16 fatty acid أو 16 carbon fatty acid allowed hydrophobic interaction with the albumin to allow for long and duration basically of binding to the albumin, slow release from the albumin. That increased the half-life dramatically. طبعا هم they tried various يعني fatty acids من C12 ل C18 بس لقوا C16 to be the best. هلا what happened later on is that they wanted to see if we can make the half-life longer, and that what we found is that the C18 diacid, وجود C18 18 carbon diacid fatty acids would enhance the half-life even better. And طبعا في other things زي linker عندنا موجود هون as you can see in the semaglutide اللي هو الأوزمبيك المعروف حاليا أكثر as an Ozempic. You'll find some features that were modified further based on liraglutide. Liraglutide فيه فقط C16 fatty acid. هنا عملوا C18 fatty acid with 2 carboxylic acids. هذا رقم واحد. رقم اثنين التشينج اللي فيها في عندنا امينو اسيد نمبر 8. تذكروا اللي حكينا عنه بالاكستنتايد سابقا اللي هو امينو اسيد نمبر 8 كان جلايسين. اوريجينالي بالجي ال بي هو الانين صح. هو اللي واحد من اهم الاسباب ليش بيصير عندنا hydrolysis by DBB4 peptidase enzyme. هون تم تغيير الألانين إلى شيء اسمه X اللي سميناه AIB. It's a unique amino acid that has 2 methyls similar to alanine بس عندنا بدل الألانين عندنا 2 methyls. هاي 1 methyl زي الألانين second methyl. These 2 methyls basically these 2 methyls that you can see are 2 compounds, 2 methyls in this in the amino acid structure as you can see. Allowed for better resistance to DBB4. So that is an unique amino acid number 8 that has نسميه methyl alanine. أحيانا يطلق عليه alpha methyl alanine as well. It's called AIB. That unique amino acid also enhanced the half-life because of those 2 changes اللي هي di fatty acids as well اللي هو وجود الدايجلوتايد وجود الاكس عفوا اللي هو الامينو اسيد الثاني. The half-life of this is now 7 days. It's 7 days. The half-life of this is 7 days. So the half-life of semaglutide is 7 days because of those 2 changes. And semaglutide has 94% amino acid homology to human GLP-1. And in this compound that has much more affinity for albumin, about 3 times affinity for albumin, and that affinity exhibits a long half-life because of that higher affinity to albumin results in a longer half-life, about 7 days half-life of this compound, which allowed once weekly subcutaneous injection. Okay. All right, so that changes allowed longer binding, better binding to albumin, longer half-life, and so semaglutide, as you all know, it's one of the best compounds to be used for treatment of diabetes, and that is one of the biggest discovery to modify a peptide to allow it to be a very long half-life and very effective compound, reducing weight, treatment of diabetes as well, and many other applications that will likely come in the future, like cardioprotective effect or treatment of addiction. You will see many more that comes much later. طيب نحكي عن السوليوشن الثاني. حكينا كل الفترة هاي انه كيف نحسن الجي ال بي 1 to improve GLP-1 basically half life, وطلعنا الانالوجز اللي حكينا عنهم ليراجلوتايد وسيماجلوتايد. طبعا السوليوشن الثاني كان انك تعمل inhibition للانزيم that destroys the GLP-1, and that is the DBB4 inhibitor. So the next thing was حكينا اذا عن فقط للتذكير انه الجي ال بي 1 موجود عندنا released بيفرز as a hormone as a response for food. وطبعا الدي بي بي 4 هو اللي بيحطم الجي ال بي 1 by removing 2 amino acids. And so there was one of the strategies is to create a DBB4 inhibitors. طبعا هو مش فقط انه DBB4 inhibitors عشان يطول الهاف لايف للجي ال بي 1. الجي ال بي 1 مشكلته الأخرى اللي هم الجي ال بي 1 analogs is that they need always subcutaneous administration لأنهم peptides, so they're not orally bioavailable, which limit the patient compliance. Also, GLP-1 analogs, as with any peptides, have the potential to be immunogenic. تعرف شو يعني immunogenic؟ يعني ممكن يسبب immunological response، ممكن يعمل حساسية تقريبا للشخص، anaphylactic shock في بعض الأشخاص. أي بيبتايد بالعادة بتعطيه لشخص ممكن يسبب immunogenic reaction. فهو يعني هو to increase half life صح، بس كمان ال GLP-1 as well itself it needs الانالوجز اللي حكينا عنهم زي الليراglutide, semaglutide needs subcutaneous administration which is not convenient for some patients. And also the GLP-1 analogs can be immunogenic. So there was always an active search, can we find another alternative way بدل GLP-1 analogs? And that was the DBB4 inhibitors. طبعا two compounds راح بيهمونا نحكي عنهم sitagliptin and saxagliptin. There are currently 5 DBB4 inhibitors موجودين بالماركت. sitagliptin, saxagliptin, linagliptin as well as vidagliptin other compound as well. بس احنا اليوم تركيزنا راح يكون على sitagliptin والsaxagliptin. Two compounds you will see that inhibit this dipeptidyl peptidase. Sitagliptin is competitive inhibitor, but saxagliptin is reversible, basically covalent inhibitor. So this is non-covalent inhibitor, this is a covalent inhibitor. Sitagliptin none, saxagliptin is covalent reversible inhibitor. أهم جزء بالساكساجلابتين واللي بدي أركز عليه حقيقة الساكساجلابتين أكثر، وبدي تطلع على هاي المويتي اللي بنسميها نايترايل أو سيانو سي تريبل بوند نيتروجين. هاي المويتي بسميها سيانو. هاي السيانو مهمة جدا بهذا الانهبيشن لهذا الانزيم. الانزيم هذا بالاكتيف سايت بسموه سيرين بروتيز لأنه فيه سيرين، والسيرين إذا بتعرفوا فيها OH. خلينا نكتب فقط سيرين لأنه السبيس قليل. هلا هذا السيرين هو اللي بيعمل basically peptidase activity، هو اللي بيحطم الامايد بوند. هاي السيرين اذا كانت موجوده next to cyano in this case saxagliptin راح تيجي تعمل اتاك على هاي الكربون ويرجع الالكترونات للنيتروجين. طيب فبنتج عندنا هذا البرودكت اللي هو السيرين والاو اتش تبعتك مرتبط، خلينا نمسح الاتش، راح تكون مرتبطه دايركتلي على هاي الكربون دبل بوند نيتروجين. تمام. as well as اللي هو the rest of the structure مش مهم عندي اللي هو باقي الساكساجلابتين. تمام. okay, so now you created a bond, covalent bond between السيرين تبعت الدي بي بي اللي جاي من الدي بي بي 4 active site. تمام. and as well as saxagliptin. This is covalent inhibition or covalent bond inhibition, but it is a reversible covalent inhibition لأنه ممكن يرجع الإلكترونات back ويحطم الرابطة. ما راح أحكي عنه بس لازم تعرف إنه اسمه reversible covalent inhibition. So saxagliptin is reversible covalent inhibitor بينما sitagliptin is just competitive non-covalent inhibitor. okay. يعني أنا مش كتير مهتم إنك تعرف الستركشرات in details، بس بيهمني تعرف الساكساجلابتين because of this cyano moiety bind in a covalent fashion, reversible covalent fashion للسيرين amino acid اللي موجود بالبيبتيديز enzyme تبع الدي بي بي 4. This is the conclusion. okay. and I drew the mechanism. الميكانيزم برضه موجود عندك in another way. Let me erase what I drew over here just to make it clear. So this is taking a picture of that mechanism or enzyme. نفس الشيء راح فقط للتذكير نحكي عنه. You will see that this basically saxagliptin, and this is the cyano of this saxagliptin, binds to the serine active site in the peptidase enzyme and bind covalently in covalent fashion to generate this intermediate that we call DBB4 عفوا, a meat complex which is reversible covalent inhibition between saxagliptin and the serine in the active site. Okay. طيب هيك بنكون خلصنا السوليوشن 2 اللي هو الجي ال بي انهبيتورز، الدي بي بي 4 انهبيتورز من حكينا عنهم. السكند سوليوشن للايشو تبعت الدي بي بي تبعت الجي ال بي 1 شورت هاف لايف. وهيك بنكون خلصنا كل الهايبوغلايسيميك ايجنتس. للتذكير فقط احنا حكينا عن كثير اشياء، وهذا سلايد that summarizes all of these things together, you will see that there is various compounds. We talked about compounds that increase insulin secretion, زي sulfonylurea وميglitide. There are compounds that affect the liver, زي metformin, liver glucose production, specifically metformin with thiazolidinediones. We talked about metformin also can enhance insulin basically sensitivity in these tissues. حكينا عن SGLT2 inhibitors that increase renal glucose, reduce glucose renal reabsorption. وحكينا عن alpha glucosidase inhibitors that reduce carbohydrate absorption. وبالإضافة حكينا آخر شيء عن GLP-1 agonist with DPP-4 inhibitors in the gut زي semaglutide, liraglutide, saxagliptin, and so on. So the treatment of type 2 diabetes in a medicinal chemistry is very variable, and it from anywhere from serendipitous discoveries to rational design and biotechnology, chemists have really developed a lot of diverse arsenal of molecules that each precisely target a key node in a complex network of disease. So this is a very good يعني various discoveries with type 2, ولسه راح نشوف في later on many new discoveries coming up in research right now for type 2 diabetes that you will hear about very soon. إن شاء الله تكونوا تعلمتوا واستفدتوا من Hypoglycemic agent واستفدتوا من هذا الفصل، وبالتوفيق لكم بامتحاناتكم النهائية، ويعطيكم ألف عافية.